Hi, Alexandria. I hope I'm saying that right. I listened and looked at your poster over hypertension. It's crazy that 1 in 3 Americans have hypertension. I mean, that's something we definitely will see in family practice. And with it to increase to 41.4% by 2030, that's 9 years away. I mean, we'll see it every day. And even in clinical, I have seen it pretty much every day. But I was aware of white coat, so I knew about that. I didn't realize that you can have masked hypertension. I guess it makes sense. And I noticed in practice that we're always educating our patients to check their blood pressures at home about the same time of day, usually, when you wake up before you get all riled up, and to kind of see what the trends are. And in practice, we're telling them if their blood pressure is greater than 140/90 to notify the provider. But I thought it was interesting the difference between JNC8's recommendation of what's hypertension and American Heart Association. And I will say the provider that I'm with now, she really treats per the American Heart Association guidelines. When she's assessing patients, her goal is to try to get their blood pressures less than 139 over 89. And she educates the patients too that if you have a blood pressure sustained over 130, you're actually causing damage to your other organs. And so she tries to see why it's so important to be compliant with medications and taking blood pressure medications. Besides typical annual labs, it makes sense you would do an EKG. So that's definitely something I'll take into practice and remember, is to do an EKG when diagnosing hypertension. As well as the different types of treatments. For example, in Black Americans, you want to use thiazide and calcium channel blockers. In patients with chronic kidney disease, you want to use ACE or ARBs. And then in your other categories, you could use thiazides or calcium channel blockers, ACE and ARBs. And then second line therapy being beta blockers and aldosterone antagonists. And then for pregnancy, using methyl-dopa, beta blockers or calcium channel blockers, which I'm kind of thinking if I have pregnant patients that have hypertension, I'm really hoping that their OB will kind of be on top of, hey, let's control your hypertension, considering it increases risk for preeclampsia and all the other complications, including pregnancy. And it is good, Pearl, to know that if they're on 3 different medications and you're still unable to achieve hypertension goals, to refer to hypertension specialists, which I don't know if you're from Springfield. I'm from Springfield. There is a hypertension clinic, and I believe, if I remember right, it's a Mercy clinic, or it may be a Cox clinic. Anyways, thank you. I definitely needed to look over that. I love these. I kind of looked over more than 2 because it's good to just kind of get an overview of the most common things we see in family practice. And I wish you good luck.